What's up? My name is Schray. I'm with Group 15 of Engineering Better Medicines. Today in the US, the cost of medicine is quite high, leaving many people unable to afford proper healthcare. Our proposed solution is to improve healthcare and medicine management by focusing on improving drug administration techniques as well as the drug supply chain. Through this, we can increase the accessibility of public health for many people. Our solution addresses the problem of lower income individuals, especially elderly people who are unable to afford continued use of their medication. Our solution would help overcome barriers such as steep costs of medication from production, transportation, and administration. High costs associated with repeated doctor or pharmacist visits as well bear a big financial burden to these people under the poverty line. Specifically, our population that is most impacted by the high costs is elderly people, which in 2024 made up of 9.9% of people under the poverty line in America. Roughly 37% of these elderly people were uninsured, leaving them unable to comfortably afford healthcare. This results in worse health conditions as they struggle to get the care they need, making them having to deal with chronic diseases long term due to delaying or ignoring care, furthering their financial burden. Up next, to talk about some examples of some proposed solutions we came up with, we have our expert in the field, Edgar.
All right, thank you, Mitchell. So the first part of the dual approach would be developing more efficient medicines. So this would include developing newer and more efficient medicines that can lead to an overall decline in cost. And a more efficient remedy could be more effective against disease or the symptoms of them. It would reduce costs of the required visits, such as the self-aggregating long-acting injectable microcrystals, also known as SLIM. A practitioner or a patient can administer the drug and it forms a crystal inside the bloodstream of the patient, which would allow for continuous release of medicine throughout the entire length of the prescription. So, like I said, a practitioner, like a doctor, could administer this, or even any qualifying or able patients, they can do it to themselves, right? So the second part of the dual approach would be improving the drug supply and market. We could implement a more efficient way to deliver drugs from a manufacturer to a user, which would decrease drug costs. Increasing the number of participants in the pharmaceutical market could expand the network overall, making it cheaper. A really good example is Mark Cuban's Cost Plus Drugs website, which sells medications directly to customers at a cheaper price than a traditional pharmacy because it eliminates any middlemen and thus reduces markups that come from that.
All right. Thank you, Edgar, for your expertise on our solution. It's greatly appreciated, and it's always welcome to have you. So my name is Gavin, and our solution of increasing the accessibility of medicine has to do with our grand challenge because it improves upon pharmaceutical production practices, incorporates and innovates new drugs and administration approaches, and it also introduces a more accessible, streamlined solution to drug acquisition. So, as we described, or as Edgar described, it existing, like I already mentioned, a key existing technology that would leverage in our situation would be the self-aggregating, long-acting injectable microcrystals. So these microcrystals, like you said, would stay in the body for a long period of time, allowing the drug to last longer and thus reducing the costs associated with administration. So that's reduces your the amount of doctor's appointments, and it can increase the dosage as well as save you money in the long run. So, and as that this technology is very new, but it can pave the way for development.
Wait. I'd like to point out that the slim injections, our solution, there's still a relatively new way of delivering medicines. And I've not been tested with lots of different types of medicines, so it's not completely practical or universal as a drug delivery method. Additionally, online pharmacies must be subjected to federal regulations, and they must be backed by trustworthy individuals to prevent drug misuse and scamming by people pretending to have cheaper prices. If anyone is able to set up these online pharmacies, people are going to set up websites with cheaper and cheaper medicines, but they don't actually have anything to sell, and they're going to scam the people that could actually be benefiting from this.
All right, Edgar. Thank you. So our next steps into making our solution a reality, we need to continue development and increase the backing and funding of drug development and the cheaper online pharmacy. So the increased development would allow for injections that treat a wider range of issues, lower costs from a wider library of medical issues due to mass production, greater sustainability, medicine that tackles greater illnesses like cancer, and faster and more reliable processing and shipping of drugs. Thank you.